My son died a lonely death without the basic care that we should be able to expect in our healthcare facilities.
The Lethole and 6 other families responded to the Health Ombudsman's findings into the circumstances surrounding the care and death of Shonisani Lethole at Tembisa Tertiary Hospital in June 2020. Lethole's mother, Patricia, said she hoped that the report would bring change and justice to other families seeking answers.
I'm a student and also an orphan thanks to Tembisa Hospital. And these months has been the 7 months that my mother has not been around. It has been hard because I had to go live with a friend since I cannot afford to pay rent. I only survive on an allowance that I get from UNISA since my mother is no longer around and I used to depend on her. And life has just been a mess. It has been filled with ups and downs while the doctors still continue with their lives.
I ended up pushing because of the pain. My baby girl came out crying, but I couldn't push the second one. It was just too hard. A few minutes later, a doctor came in to help. There was a faint heartbeat. He told me to push and he would pull the baby out. I was informed that I could not be taken to the theater as they were never notified about me or my condition. The doctor continued to pull the baby, but it was in breech position, legs first. He kept on trying, but in the end, he turned to the nurses and said, "The baby's dead." Then that's how I lost my daughter.
The Gauteng Premier, David Makura, several times coming out of in media saying that Gauteng is ready to deal with issues of COVID. But we are seeing people suffering on the ground. We are seeing patients being taken to COVID wards without even testing. I'm talking to you today. My sister tested on the 19th of January. Up to today she hasn't got her results. So people are dying and with anxiety. People are dying without having their results. So the question is, how more people have to die? And people, as much as we are suffering from COVID-19 pandemic, but also our system suppress us or oppress us and make us to die while we are waiting for results, while we are not treated fairly. We've been saying that our healthcare system is in crisis, but nobody listened to us. And politicians are standing out on television and everywhere in the media saying we are ready. What readiness are we talking about? What kind of readiness are we talking about if people are still dying like this?